Hello, welcome to ExpertCast, a podcast dedicated to discussing the latest innovations in healthcare, supported by Agfa Radiology Solutions. I'm Gustavo Meirelles, radiologist, healthcare entrepreneur, and founder of the Healthcare Innovation Community. Today, I have a very special guest joining us, Jeroen Spruyt, the Global President of Agfa Radiology Solutions, to discuss a relevant topic, Beyond the Scan, AI, sustainability, and global perspectives about radiology. Welcome, Jeroen. I'm very glad to have you here with us today.
Okay, first of all, thank you, Dr. Gustavo. It's really a pleasure to be here. Just to be sure, I can say Gustavo in the remaining part of the podcast.
Yes,
that's
of course.
Perfect. So thanks for the opportunity of joining the podcast, and not only for inviting me to join the podcast, but I combined it also with a visit to my wonderful team of Agfa Radiology Solution here in Sao Paulo, and it was a pleasure to also spend some time with the team as well. I'm really pleased to be here in this kind of podcast and to speak about the topic of how we bring innovation into healthcare, because at Agfa Radiology Solutions, that's also really what we are aiming for, what we try to desire, how we want to put also our company at the front line of innovation and really show how we can bring more value to our current solutions and our current modalities, helping all our patients. But before we go forward with the podcast, I also had a question for you in the beginning, and that's, we kind of got to know each other
That's great. That's
1 year ago or something like that.
Yeah.
And I was quite intrigued with a person that makes that pivot from where he was to really also being very explicit about innovation, starting a podcast. So what is driving you in doing that?
Well, I like to say that I've had some different lives in my life. So maybe the first one was an academic radiologist, publishing a lot and doing my doctoral thesis, and then a postdoctoral study in the United States. Then I have worked as a doctor for many years here in Brazil at Fleury Group, which is one of the leading healthcare providers, and then at Aliança Saúde. Also as a healthcare executive. And then for the last few years, I've been working closely with innovation. So this is quite hard to be changing roles all the time, and you know it.
I can imagine.
You're also an innovator, and then you can talk a little bit more about your previous experiences before joining Agfa Radiology Solutions. But as a radiologist and also as a doctor here in Brazil, I see there is a wide space for innovation, not only for bringing new technologies and new solutions to Brazil or delivering it worldwide, but mainly to provide access to a wide number of people, specifically in a country like Brazil with more than 200 million people living in it. But, many of those people don't have access to a good healthcare service. So I think that working more and more with innovation can be like a game changer for delivering a better healthcare for most people here in Brazil. I hope so.
Yeah, that I can only imagine. That's a nice way of standing in that ecosystem. And I think on that level, I'm super pleased that we also found a way to get together and to discuss these items into healthcare. So looking forward to this podcast, basically.
Well, it's been a pleasure. And I also have the pleasure of being part of, the global advisory board at Agfa Radiology Solutions. So it's always very good to have new connections and also very good interactions among those who are here in Brazil, in India, in Australia, Europe, in North America, in many different places of the world, and talking about innovation. And I'm not sure if you know about it, but we've been building a healthcare innovation community here in Brazil, which has now more than 8,000 members. It's growing quite
impressive.
fast. And the plan is also to do cooperation among different players, so investors, entrepreneurs, big companies, startups, and discussing new technologies and solutions in the healthcare innovation ecosystem.
Okay, that's indeed impressive and highly needed if you look at the challenges of healthcare worldwide. So yeah, that's a good objective to realize. Yeah.
Yes, we hope so. But thanks for the introduction. And now we have to switch roles again. And I would like to hear more about yourself and also a little bit about your experience in your new role with Agfa Radiology Solutions. So if you can tell us a little bit more about yourself before going to the questions, that would be great.
Okay, fantastic. So like you introduced, I joined Agfa Radiology Solutions about two to 3 years ago with the main objective of really seeing how we could reconnect to the innovation front-runner player that we have been in the past. In an area where we were really technology leader in the film and print solutions and also in the computed radiography. And we're now moving forward and also looking into how we can use technology, not just to be innovative, but how we can also in a practical way embed it in our solutions and make sure that we deliver more value, not only to our customers, but also to the patients that are directly benefiting from those solutions. And from a personal perspective, I have a background in completely different industries, but I've typically always worked in environments where using technology to really fundamentally improve productivity and also the value of the solutions that you're bringing to the market has been a key differentiator and has always opened up more potential for the business that I was in. And that's also what we try to do with Agfa Radiology Solutions. We're really trying to see how we can embed technology and innovation in our solutions to broaden the application field and also the value for our customers and for the patients of our customers. And for me, it's an incredible journey. I'm now 3 years into healthcare. Have been in automotive before. Have been in the space where it was more solar tech and wind tech. I've been working for private equity. I have also been working for venture capital. Now I'm working in a stock listed company. So the environment is really challenging. It's different. But at the same time, a lot of the challenges are the same. So we see around the globe a lot of innovations, a lot of hypes, a lot of hot topics, like we will most likely also discuss today. And the key question and the key game changer is always when we are capable of really integrating it into a solution that brings concrete value. And for me, that is really what is driving me also. That is also driving my teams and the discussions that we have inside Agfa Radiology Solutions. That has also been the reason why we push a lot on having a radiology and a radiologists advisory board, where we try to really understand what our customers want, how they see it, how they interact, what are the potential questions that they have towards the integration of new technologies, what are the fears, what are the boundaries, and how we can deal with it. And I'm more than happy to have you as one of the members that has joined that Radiology Advisory Board, but it's also really a pleasure to see that these are members from different parts of the globe, economies in different levels of maturity, also different healthcare systems, public, private, and having all these views and trying to figure out what we need to do with it. That's what is driving us, and that's what is motivating us on a daily basis. So
yeah, it's been incredible. And for the next episode here, I'm going to have the pleasure of receiving some of my colleagues from the Radiology Advisory Board, like Dr. Bhavin Jankara from India, who is going to discuss the similarities and differences between India and Brazil related to innovation in healthcare, specifically radiology. So I've seen that your life is quite busy compared to many, I would say, regular lives around the world, because you've also been changing from roles, from automotive industry, then to a private equity, and now working with healthcare. And maybe my first question here is going to be related to the main innovation in healthcare in the last few years, which is artificial intelligence. So we know that AI is getting more and more advanced every day, and it's quickly becoming part not only of our healthcare lives, but of our day-to-day lives. However, artificial intelligence is also seen as, a double-edged sword, because it brings efficiency and accuracy, but there are two questions. The first one is related to the role of radiologists in a world with AI. And the second one is related to costs. So I would say that some people will look at AI in healthcare as another layer of cost in a system that is struggling, at least here in Brazil, is struggling to be profitable. So I would like to get your impressions on the integration of AI on radiology solutions and also the relation between artificial intelligence and the radiologists of the future.
Yeah, that's. I think first of all, it's a nuanced discussion. But let me first of all say that for me, it's not purely about AI; it's about software in general, and that's interesting. If you look at the DNA of the company that I represent, is the long history we have also with software solutions and embedding software to really deliver also value in the day-to-day application field. So for ourselves, we have defined whether it's AI, whether it's machine learning, computer vision, or just simple software tools. We kind of have defined that we see 3 clear areas where we want to introduce it when it comes to radiology. So the first area for us is really about image quality. We see a clear role for all these solutions to improve the way we can make the image we get out of an X-ray exposure just more nuanced, more detailed, and better to interpret. And that is not a purely AI story. That's also a computer vision story where you want to have explainability. You don't want pure black box AI where you cannot explain why you are highlighting a certain item. We want to be able to explain why we are improving the image, and maybe not how, because that are our secrets, but we want to be sure that people understand what we are doing and that we can guarantee them how our algorithms are working. The second area where we see that software, but definitely AI is coming in, is when it really comes to improving the workflow, improving automation of the treatment that basically a patient is undergoing. And I think that is really an area where you also see that nuanced debate between is it a computer or is it a human? So we are not there with our workflow solutions to target to replace clinical people that are in the room together with the patients. We are there to really make sure that the people with the clinical background, the patient care, can focus on the patient and that they don't have to focus on operating a room, operating a machine. This machine should be as natural as it can be related to the workflow that is required for the patient treatment. And that's really where we see the value of AI, where we see that software that is interpreting how a patient is positioned on a table and then adjusting a little bit the room. That is just something where we don't want clinically trained personnel to put attention to. That should go automatically. They should be comforting the patient. They should be monitoring the patient, read certain signs of the patient to interpret how it's going. And then the third area, and I think that's a more new area, where I think the entire discussion about is it just adding cost or is it really adding value is the most active at the moment. That is really adding clinical value to X-ray. That is really to look at how can we use algorithms, how can we use AI to interpret the image acquisition and to already give a clinical analysis to what or what the algorithm sees in the image and nuance in which direction the interpretation of the results should be. And there, I think it's really a nuanced debate because for one, we will never have an AI which is fully holistic. What we do expect from a trained radiologist. So we're always validating against certain assumptions, which is it's a fundamental different way of looking at it. And the second thing is that also with giving indications of what can be and what cannot be, if we give too many false positives, we might draw attention just in the wrong direction and create even clinical risk. So it's really a nuance that we should have. At the same time, we also see that some of the startups in the AI world, I think they did an amazing job. They are delivering amazing solutions, but they also did it based on amazing high projections about recurring revenue that is there coming out of these AI solutions. And if you start to add all this up, then you come into a very difficult discussion in healthcare related to what is the value of these additional clinical insights, and does it weigh up compared to the additional load you put on a healthcare system, which is already struggling with being affordable. So for me, it's really nuanced on that level.
Well, I totally agree with you. And I see that AI, well, the first thing is that AI will probably never be like a one-size-fits-all solution. So just having one AI for looking at a chest X-ray or a abdominal CT. So radiologists are going to lead the whole set of data that is going to be, produced by the new AI solutions. So that's my first point. And then second point, I can give the example here in Brazil. For most of hospitals in Brazil, including the best private hospitals, X-rays at the emergency rooms are not read by a radiologist. So they are seen by a clinician or a surgeon that is dealing with the patient and needs an immediate response. So there is a layer of cost today related to incorrect diagnosis made by physicians that were not trained for reading X-rays. And then, well, if I have an AI looking at every single X-ray and detecting pneumonias, for example, that were false negatives, or the other way around, looking at the chest X-ray and denying pneumonias that were reading as a pneumonia by a practitioner, a general practitioner. So this is not adding a layer of cost. This is actually cutting costs and providing more efficiency. And last but not least, I also see that radiologists are going to work together with AI and they won't be replaced by AI. So this is one of the first fears of my colleagues. And again, when I look at the car today, we're not running against cars. So we are using cars as a machine to get us further than by walking or running. So this is how I look at AI or cars. So I can use it. I'm not competing against it. And then, well, I don't know if you have any other points about it.
It's very clear. We will have to find a way to really make sure that the coexistence and the way we learn from how we should embed AI in solutions is there. But there was one other point which I wanted to pick into, and it's for me it's a more personal point, I think, and that was your remark on how in emergency situations X-ray is being used. So for me, when I joined Agfa Radiology Solutions and when I started focusing on X-ray, there were a lot of people who were indicating like, yeah, but this is, if you look in the medical imaging landscape, why do you go in that direction? There are more what they call sexier or more complex solutions to be there. And I think that is for me, at least, what I made out of it. And gently, gradually, we're also embedding that in the DNA of all the people that work inside Agfa Radiology Solutions. Is what we see is that X-ray is, I would even call it an entry modality, in the sense that it's typically very early in the path of care of a patient. So very early in his interaction with healthcare, he will be confronted with X-ray. It's often at moments that they don't fully know what they have. It's often at moments that it still needs to define in which direction the remaining treatment will go. And what we really see is that given the position of X-ray exactly at that point, we truly believe that if we start adding value to that modality and increasing the speed with which we can define the right treatment, increasing early detection, then the value of embedding technology in X-ray is just fundamentally high. And it's potentially a lot more sexier than going into a very niche application, at least for me. I try to see what the impact is that we can have. From a technology point of view, it might not be the most sexy thing, but from an impact point of view, we really see that with some of the solutions we gradually are bringing to the market or already have into the market, we're really having an impact, and we not only have an impact on our customers who are using our solutions, but we also have an impact on people that are, or patients that are really at the moment of most confusion in their life. They don't know yet what's ahead of them. They still need to get the first assessment of their health state. And the more we can add value, the more we can add insights, I think the more we bring to global healthcare from an X-ray solution.
Yes, and again, I can remind of Brazil, well, being a very big country of continental dimensions. And then I also remind of previous episodes here at ExpertCast. So we do have a project today, which is fantastic, called Open Care 5G, which is led by the main hospital here of the University of São Paulo. And they are putting ultrasound machines, and in the future, ultra-portable X-rays in very remote areas in Brazil. For example, indigenous territories. And then connecting those equipment to 5G networks. And then, I can, for example, screen in very remote places people with an ultra-portable X-ray for tuberculosis.
Yeah, and so these are just great advances.
You never do it with a chest CT or an MR scan. And again, another point here, we can also use X-rays with AI for detecting conditions that we didn't think of X-ray as a method in the past. So, for example, osteoporosis. We do use DEXA scans for that. And we can probably use, and we are using more and more X-rays with AI solutions embedded in it you can give a diagnosis of osteoporosis. You can, and you can connect it to DEXA scans, but at least you can do like a screening of thousands or millions of people who would never get those diagnoses.
That's I really don't want to go too much in branding Agfa Radiology Solutions and its products, but as you know, we're absolutely going into that direction with one of our products, and for us that is really an area where we see that additional value. If we go into what we call opportunistic screening, meaning the X-ray image has been acquired anyhow for another reason. And we can add an additional screening methodology to really identify whether there is a risk for another disease. And we can then improve also the reliability of referring that patient to an additional treatment. I think that is really the direction we should take. At the same time, you were there when we had that discussion also with our radiology advisory board about also our role from a societal point of view as Agfa Radiology Solutions, of thinking about not just blowing up the healthcare budget. So if we push patients into an additional care trajectory, we better be very right in pushing them there, because if we start just referring a lot more patients to it, we're also not contributing to what we want to do. So we take that very serious. I think we're progressing really good with it. It's also a bit of fight with the healthcare system to start to recognize these alternative diagnostics that you can do with X-ray, to get the right reimbursement schemes in place, to get really validation that it's equivalent to another examination. So that is exactly what I mean, and the direction we should go into.
Yeah, so it's probably part of a new healthcare system in the future, we hope so. So I get to go to our final question of that first half of our episode, and this is related to sustainability in radiology. Also, another very important point, we had previous episodes here at ExpertCast where we discussed the relation between climate changes and healthcare, so sustainability. And this is becoming more and more important across our industries, including healthcare. So healthcare is one of the main industries in the world, and it's also very connected to climate change. If you look at, the waste we make at every single industry, including healthcare. So how do you see the balance between innovation in healthcare and sustainability? And do you believe that having cutting-edge technology and environmental responsibility could coexist in radiology?
Shortly, I think absolutely it should be. But when it comes to sustainability, I think it's also it's an important element to know that Agfa Radiology Solutions is also part of the Agfa group. And when we look at how we look at sustainability, we take it really serious, but on various levels. First of all, we look at our businesses where we are in. So Agfa has been pivoting more and more of its businesses into what we call sustainable businesses, green businesses. We are in green hydrogen. We focus on healthcare. So we're really committed as Agfa also to make the place just to make the world just a better place. So it's really in the way we are positioning ourselves as a group. Secondly, we also commit to run the company in a way that we reduce our own footprint. And there, in a way, it also helps being a stock-listed company, being required to report on what you're doing for sustainability. And we're not only looking to our own footprint, but gradually we will also start looking at the footprint of our suppliers. And we will also challenge how they are doing that. At the same time, it also means that in everything we do, we have to integrate that sustainability part. And for example, for Agfa Radiology Solutions, I can be very explicit. The moment that we start an R&D project, we have an environmental impact assessment matrix where we will really check, is this product bringing us closer to a sustainable future? And we will verify this at different levels of the solutions. We will follow it up during the execution of the project to be sure that with each new introduction, with each improvement, we get a bit closer to it. And then thirdly, I think it's also sustainability. It's not only about CO2 emissions, but it's also about how do you contribute to society? How do you contribute to safety of your employees? And on the society level, I think we already touched on our role that we have in also monitoring that we don't blow up the global healthcare budget and these kind of items. We really take that seriously. On our employees, we are focusing really on how do we make sure we have a heterogeneous population in Agfa Radiology Solutions, how we make sure that everybody feels at home. How we also make sure that we are a safe working environment on both the psychological as the physical level. And that is really how, as a group, we see sustainability. And that's I think, also a benefit of being part of a bigger group and also how we translate that to Agfa Radiology Solutions. And then on innovation, I think innovations that are today not helping to become sustainable, they will eliminate themselves. In whatever industry you are. You will today I think you will not find the funding anymore. You will not find companies that want to integrate it in the solutions anymore. You will not find the customers anymore. You will have so much pushback that it just stops. So I believe it's an absolute necessity on that level.
I'm glad to hear that. And well, unfortunately, we have reached the end of the first half of our episode because I would like to continue discussing nice topics like this one, but we'll have more time for that on the second half of the episode. So again, Jeroen, I'm very glad to have you here with us today. So thanks for being part of ExpertCast.
Okay, thanks. It was a pleasure to be here, and I look forward to the second part.
Me too. So
Thank you.
Looking forward to have you here in the second part for continuing our discussion. And well, ExpertCast has the support of Agfa Radiology Solutions and also the production of Pods. Don't forget to follow us and rate us 5 stars on your favorite podcast platform, as well as share the episodes on your social media and with your contacts. By doing this, you help to disseminate quality information and increase interest in healthcare innovation. Thank you, and see you in the next episode.